Welcome back. It's been a week since the tragic death of Chadwick Boseman, the actor who inspired so many. Boseman passed away due to stage 4 colorectal cancer. And tonight we bring on Dr. Jaime Baquero to explain more about the disease and some preventative measures as well. Thanks for joining us, doctor.
Absolutely, Jacqueline.
So many people, of course, really devastated and shocked by Boseman's death, a cultural icon, a Hollywood hero playing most recently, I do believe, Black Panther. So how do you hope his death will encourage others to get tested?
Absolutely. Colorectal cancer is actually a very frequent disease in the United States. And often people believe that colorectal cancer is a disease only of, elderly population. What I think brings about his death is the fact that he was only 43 when he died. And then it does bring the possibility that this disease can affect people at a very early age. As a matter of fact, there are ways to prevent colorectal cancer if you can get the adequate screening at an adequate age. Despite this, he was 43, he was very early stage cancer. And thus, I believe that people should take this into account and believe that this is a real disease and it's a disease that people have to be aware of and potentially be talking about your doctor about ways to diagnose as well as to prevent what happened to him.
Sure. So as you mentioned, he was only 43 years old. This highlights the issue really of early onset colon cancer and screening recommendations. I know recently, I do believe the board that oversees this suggested moving the screening recommendation age from 50 to 45. If I do, you may have to correct me on that. But does this point to even maybe younger ages trying to get screened for colorectal cancer?
Yeah, so there are actually two things that we have to take into account. Is one, the official screening recommendations right now is age 50. Having said that, we have seen over the last approximately 10 years that the increased incidence of colorectal cancer is on ages that are below age 50 years old, and thus a lot of societies are advocating to initiate screening at age 45. Despite this, the official recommendation is to start at age 50. Regardless, you do have to take the risk factors of each individual, i.e., do you have a family history of colorectal cancer? And also the different socioeconomic as well as different backgrounds definitely increase the risk of having earlier cancer. There are different populations, including African Americans, that tend to develop colorectal cancer at early age. As a matter of fact, they're suggested that African American population should be screened at age 45. They tend to present earlier with more aggressive disease and more symptoms than anybody else. But the official recommendations currently is age 50. Now, when you're talking about screening colonoscopies, that means somebody who has absolutely no symptoms. They don't have any abdominal pain, no rectal bleeding, no changes in the bowel habits, and they go in for a physical examination. They're required to have a colonoscopy age 50. And out of those people, almost 30% of the population are going to have polyps. And polyps, as many of you may know, are the precursors of actually colon cancer. And by removing these polyps at that age, you can actually prevent the formation of cancer.
So let's talk a little bit about some of these risk factors. You mentioned, disproportionately affecting Black men and African Americans. So what are some of the other risk factors and how can you prevent this from happening?
Absolutely. So you can kind of divide the risk factors for colorectal cancer into things that you can control and things that you can't control. I call it things that you can control, your family history, which is very important. If your mom, your father, your brother or sister have had either polyps or cancer, especially early age less than 60, that increases the risk of you having colorectal cancer. Now, things that you can control include diet, high fiber, fruits, vegetables, decrease the possibility of having colorectal cancer, as well as things that could negatively affect it, including drinking, smoking, are things that you can definitely control. Now, there are populations, including Native Americans as well as African Americans, that tend to be affected more frequent, younger age, as well as more aggressive disease. And thus, as we alluded to, these populations should be screened a little bit earlier.
Okay. Doctor, lastly, now this is what I understand to be the third deadliest cancer here in the U.S. Talk to us a little bit about the importance of catching this early on and just how that might be able to change the direction of where this disease progresses.
Absolutely. So, just talking a little bit about numbers so people can see the impact of the disease. In the United States, approximately 150,000 people are diagnosed with colon cancer each year. And out of those, 50,000 people actually may die. Now, having said that, 90% of colorectal cancers can be prevented or treated early. I.e., if you have a colonoscopy and you detect things that are called precancerous lesions, that means things that you can actually see, remove, and take away, decreasing actually the progression of colon cancer. The idea behind cancers is that if you have an early diagnosis, you have a better chance of doing well down the road. I.e., if you have a very early disease, it can be treated non-invasively, i.e., just with a colonoscopy, and have outcomes equally as anybody else in the population. If you tend to ignore the disease and you wait until symptoms arise, i.e., abdominal pain, rectal bleeding, changes in the bowel habits, you're going to see that the disease at a very late stage. And when it's a late stage disease, there are all those things that you can do. The possibility of doing well is less. As you saw with the death of Chadwick, he was somebody who was 43 and unfortunately was diagnosed with a stage 4 cancer, which means a very progressive cancer. And at that point, even if you do therapy, the possibility of doing well lessens.
All right. Well, Dr. Baquero, thank you so much for bringing this information to our attention. Hopefully we were able to help some of our viewers with this important information. Appreciate it.
Absolutely. Have a great night.
You too. We're just getting warmed